Okay, so we're going to talk about heart failure. This is something you see a lot of in the hospital. People can sometimes live with it when it's not severe. Sometimes they end up in the hospital because of it. Um, it's a chronic disease that occurs when ventricles of the heart are unable to contract effectively. So basically, the blood pools in your heart. Now, there's congestive heart failure is similar to heart failure. So in chronic heart failure, um, both of the ventricles are not working very well together. Okay. And that's why the blood pools in your heart. A lot of times, what they'll do is they'll give them an isotonic to make it squeeze harder to get the blood out of the heart. Congestive heart failure is similar, but it's left sided and right sided. So you got to remember that the left side of the heart, the left ventricle, is what squeezes the blood to the rest of the body. So the blood comes in from the lungs to the left atria to the left ventricle. Okay. If the left ventricle cannot get enough blood with its squeeze to go through the aorta, the blood backs up, right? Because the aorta, the atrium, can't dump a lot of blood into the ventricle because there's always some there. And after a while, you get what's called pulmonary edema because the fluid and the blood back up in the lungs. Okay. Right sided, it's the opposite. So, right sided, it can't push the blood to the lungs. So that means that the blood coming back to the right atria is going to back up because the ventricles aren't working properly. That means that the right atrium is not able to fill the right ventricle because it's not squeezing properly, and everything backs up into the system. And this is why when you see right-sided congestive heart failure, their hands, their legs are swollen. A lot of times they put people, depending on the severity, they put people who are in congestive heart failure on fluid restriction just because their body cannot get rid of the fluid. In order for blood to be, or I'm sorry, in order for blood to be cleaned and extra fluid removed, it has to go through your kidneys. And if the right side of your heart is not squeezing the blood, enough blood to the lungs, then not enough blood is coming back from the lungs to be squeezed to the body, and your kidneys aren't working right. So um, they restrict your fluids. The treatment for this is cardiotonic. That's a drug that makes the squeeze a lot harder, and diuretics to get rid of excess fluid. Rhythm conduction defects. We kind of already looked at those. First degree block is just a little bit slow. Second degree block, there's two of them. Go back and take a look at the pictures. Third degree block is the one where there's the P's and the QRSs are not together. Then there's a thing called premature contractions. And this is an arrhythmia disorder, but most people it doesn't matter. So atrial fibrillation, that one is the one where you're not getting a good squeeze in your atria. And that means that the blood kind of swirls around and it can sit there and form a clot. You have to have that squeeze. People can live with atrial fibrillation. They kind of get tired, right? Because there's not a good squeeze to get that to the right ventricle and to get it to the enough blood to the lungs. So people with atrial fibrillation can get very tired. And a lot of times, depending on the age of the person, they'll convert the rhythm, they'll shock them. So they'll put you under anesthesia, they'll get the defibrillator, and they'll shock and try to get the electrical impulse working again. Because remember, with fibrillation, none of the cells are talking to each other through the intercalated disc. They're all kind of doing their own thing. And they're hoping that they can convert that rhythm to shock the heart back into a normal sinus rhythm. Sometimes in elderly people, they won't do that because they can't tolerate it enough, or like my dad had it done and it didn't take. It just kept going back into AFib, so he just stayed like that. Premature ventricular contractions. So you know that when there's a normal, PQRST. So what will happen is you'll have a PQRST and then another QRST. People have them all the time. It's not a big deal unless you're getting them frequently. If you're getting them frequently, then you're not getting enough preload, right? Because the blood coming back from the body comes back into the ventricles, and some of it's going to the lungs, but there's not a whole lot to redo it, because you have that normal beat that squeezes the atria squeeze blood into the ventricles, squeeze it in on the right side to the lungs, on the left side to the body, and then before the atria can refill those ventricles, they squeeze again, and there's not a whole lot of preload because there wasn't time. And so you can have somebody with frequent PVCs and they'll get that fatigue because there's just too much going on. Ventricular fibrillation, that is a lethal rhythm. Your ventricles, you absolutely have to have them working, because if you don't, you're not getting oxygen to your blood and you're not getting blood to your brain. Okay, heart trauma or injury occurs when a blunt chest injury causes contusion to the heart muscle. Hearts can get bruised. Motor vehicle accidents, falls, or direct blow. They can be fatal. In a motor vehicle accident, if you hit the steering wheel, you can bruise your heart, and it can kill you. Also, you can break your ribs. Your ribs could damage the heart. A fall, same thing. Direct blow, there was a young man who got hit in the chest with a baseball, and when he got hit in the chest with the baseball, it contused his heart and interrupted his electrical conduction, and he died. Usually contusions heal like in 2 to 4 weeks, like normal bruises. You may feel tired, and the doctor may have you on special orders to rest. You don't want to make that heart work very hard because it's bruised, and it hurts. Just like if you bruise your leg and you have to use your leg. Any structure and functions of the organ and circulatory system affected by trauma should go back to normal. It just depends on the trauma. Let me see what else we see. Okay, and before we do that, you can also, in an accident, damage your aorta. You're going forward and then back, and when you go back, your heart, your insides are going forward, and you can tear your aorta, and that is a lethal injury. That's all I got to say about that. Types of heart surgery. Okay, so you have pacemakers. So a pacemaker is something that they put in your heart when your heart is not doing what it's supposed to do. It's not beating regularly. So the pacemaker regulates your electrical impulse and therefore your rhythm. So if you go into a third degree heart block, sometimes that's what they have to do. They have to put a pacemaker in. There's also a condition called sick sinus syndrome. When you don't have a regular rhythm, they have to put in a pacemaker for that too. It regulates the electrical impulse. So if your heart is beating normally and then all of a sudden it stops, your pacemaker can kick in. Or sometimes the pacemaker does all of the work. So they most have 2 leads, one for the right atrium and the other for the right ventricle. You can also have a defibrillator, an internal defibrillator with a pacemaker. And that's if you're pacing and all of a sudden you go into a lethal rhythm, your internal defibrillator kicks on and kicks you in the chest, gets your heart going again, hopefully. We talked a little bit about angioplasty. Angioplasty is when they feed a wire through your heart and your circulatory system to an artery that's blocked, and the deflated balloon goes into the coronary artery, and then it's inflated. It pushes all the plaque aside, and then it's deflated and removed. Cardiac stents are when you have these little nets. They're stainless steel devices, and they hold arteries open after an angioplasty. So you get the angioplasty, it opens up the artery, and you put a stent in there, and then you have to leave it in, that stent in there, to open up that artery. A lot of times these days, especially, they're drug coated. And when you have these stents, you usually have to take anticoagulants because even though you have a stent and it's helping you, it can be a little rough. So they'll put you on anticoagulants. It depends on the type of stent that you have. And then we already talked about cardio. Uh, um, I'm sorry, coronary artery bypass. They take a vein from your leg, they go around the blockage, and they revascularize your heart. Um, laser transmyocardial laser revascularization. Lasers to punch holes in the heart muscle to improve blood flow. I am not familiar with this procedure. I've never heard of it. I guess it's good for patients who can't have an angioplasty. I'm not really sure of the science and how it works, but it creates a tiny hole through the muscle wall to blood filled chamber, and the outside of the hole heals quickly but leaves a channel that allows for the blood to reach a muscle. I'm not really sure. I'm going to have to do more research on that because I really don't know that. All right, guys, that brings us to the end. I know we're a couple of minutes over, but that's the end of the heart chapter, and we'll talk about it in class. I'll talk to you later.